Matre Namaha. Now I am going to elaborately express my views on natural depression treatments. Let us see the topic after the prayer. Tridalam Triguణakaram Trinetram cha Triyayudham Trijanma Papa Samharam Ekabilvam Shivarpanam. Being depressed can make you feel helpless. You are not, along with thereby and sometimes medication. There is a lot you can do on your own to fight back. Changing your behavior, your physical activity, lifestyle, and even your way of thinking are all natural depression treatment. There are some tips to you feel better straight right now. Number 1, get in a routine. If you are depressed, you need a routine. Says, I can cook, I can paint, like that. You have to have some routine work. There is a doctor called Cook. He is a psychiatrist and director of the Depression Research and Clinic Program at UCLA. He says, depression can strip away the structure from your life. One day melts into the next. Setting a new gentle daily schedule. It can help you get back on track. In this regard, you have to have set goals. When you are depressed, you may feel like you can't accomplish anything, achieve anything. That makes you feel worse about yourself. To push back, set daily goals for yourself. Start very well. Cook says, make your goal something that you can succeed at, like doing the dishes every other day. As you start to feel better, you can add more challenging daily goals. In the another, exercise. It temporarily boosts feel good chemicals called endorphins. It may also have long term benefits for people with depression. Regular exercise seems to encourage the brain to revise itself in positive ways. Another, eat healthy. There is no magic diet that fixes depression. It's a good idea to watch what you eat, though. If depression tends to make you overeat, getting in control of your eating will help you better. Although nothing is definitive, Cook says, there is an evidence that foods with omega 3 fatty acids and folic acid could help ease depression. 5. Get enough sleep. Depression can make it hard to get enough shut eye, and too little sleep can make depression worse. What can you do? Start by making some changes to your lifestyle. In this regard, you go to bed and get up at the same time every day. Try not a nap. Try not to nap. Take all the distractions out of your bedroom. No computer and no TV. In time, you may find your sleep improves. Another one. Take on responsibilities. When you are depressed, you may want to pull back from life and give up your responsibilities at home and at work. Don't. Staying involved and having daily responsibilities can help counter depression. They ground you and give you a sense of accomplishment. If you are not up to full time school or work, that's fine. Think about part time. If that seems like too much, consider volunteer. Next, challenge negative thoughts. In your fight against depression, a lot of the work is mental changing how you think. When you are depressed, you leap to the worst possible conclusions in the form of committing suicide, etc. The next time you are feeling terrible about yourself, use logic as a natural depression treatment. You might feel like no one likes you, but is there real evidence for that? You might feel like the most worthless person on the planet, but is that really likely? It takes practices, but in time you can beat those negative thoughts before they get away out of world. Next, eighth one. Check with your doctor before using supplements. There is a promising evidence for certain supplements for depression. Cook says those include fish oil, folic acid, and same. But more research needs to be done before we will know for sure. Always check with your doctor before starting any supplement, especially if you are already taking medications. Ninth one. Do something new. When you are depressed, you are in a rut. Push yourself to do something different. Go to a museum, pick up a used book, and read it on a park. Volunteer at a soup kitchen. Take a language class. When we challenge ourselves to do something different, there are chemical changes in the brain. Trying something new alters the levels of dopamines, which is associated with pleasure, enjoyment, and learning. Another 10th one. Try to have fun. If you are depressed, make time for things you enjoy. What if nothing seems fun anymore? That's just a symptom of depression. You have to keep trying anyway. As strange as it might sound, you have to work at having fun. Plan things you used to enjoy, even if they feel like a chore. Keep going to the movies. Keep going out with friends for dinner, etc. Another 11th one. Avoid alcohol and other drugs. Substance misuse is common in people nowadays who have depression. You may be more likely to turn to alcohol, marijuana, and the other drugs to deal with the symptom of your depression. This unclear if drinking and using drugs cause depression, etc. But long term drug use could change the way of your brain works and what you say worsen or lead to mental health problems. When you are depressed, you can lose the knock for enjoying life. Cook says, you have to relearn how it do it. In true fun, things really will feel fun again. 7 ways to overcome depression without medication. Many psychological interventions can help promote him improved mental well-being with or without antidepressants. To overcome depression, it helps to know the facts. Depression is a medical condition and not laziness or a temporary response to normal grief and disencouragement. Symptoms of depression. A major depressive episode is defined as expressing 5 or more of the following symptoms every day for 2 weeks or more. Depressed or irritable mood. Another one. Sleep problems. Sleeping too much or too little. Sleeping mainly during the day. Change in interest in which you and enjoy or go to lower level motivation. Excessive guilt or unrealistically low self image. Similarly, what you can say sequently or frequently, whatever the simultaneously it is, words connection with other people. They have low energy and change in its self care. Change in appetite. Agitation or anxiety pandemic attacks. Social thoughts forms is behavior including self-harm. It's most important you can remember that not everywhere who is depressed is sauced or suicidal. You can still seek help. It is the time you have to plan your lifestyle. Even we help, we have not recommended, demonstrated, and not awarded to coming to Guntur, etc. But in this sense, it is mere eager to know that simply waking up early, doing exercise in time, and having some drop of coffee later, come to this speech. You will be worthwhile. Okay, I am feeling depressed. So now what? Now that you know the Vedas, symptoms of depression should be elaborately explained. All of the following techniques are supported by scientists. Synthetic in research and material prescribes the while psychiatrists and these people are frequently recommended as important parts of treatment. Even the patients who continue to take anticipation depression medication also. Let us practice there is some conspiring skills every day. I recommend doing many, if not all, of the following can simply take it away. It is important to know you probably by want worthless. At the same time, your problems, everything, to do any of them at first because depression frequently saps motivation uh, in the words, other words, know that isn't normal to feel sad. Unmotivated until you are away, half away, done. The planets I work with who frequently protectants. These coping status technologies can be what you say Avinash Reddy. With those he may become one of the AP Mantri. Find small ways to be of service to others. Find personal meaning by serving something larger than yourself. Remember, when does not have any potentiality to not be grown up. Spices like happiness or together coming and making the discussion between the what we say firm as the unintended side effect of one's personal dedication to cure greater than oneself. Another, your goals. Find workable garden that give you a sense of accommodation. Feel guilty. Most people feel guilty when we're talking about goals because they set another solvable or unworkable goals. A gift is a goal is workable. So yajna kanya. Your goals. Find workable goals that give you a sense of accomplishment. Most people feel guilty when talking about goals because they set an unreasonable or unworkable goals. A goal is workable if it's one something you can control. It does not depend on others. Number 2, manageable. It means not overwhelming. 3, realistic for you, not for someone else. 4, measurable. Mean you know whether or not it is done by or getting done. 3, pleasant events, schedule pleasant activities or events. Don't wait for yourself to be in the mood. For example, give yourself permission for a 30-minute vacation or schedule a healthy hobby every day. Just remember to do these activities with the right attitude. Also, practice gratitude. Take time to notice that went wrong. Consider keeping a gratitude journal. Know that being grateful for your blessings does not mean you have to discount your problems. Another one, engagement, stay in the present. This practice is sometimes called mindfulness. As the best we can provide, you may not be able to turn off the self judgment, but you can notice it and bring yourself to the higher self worth or self confidence. For those who have difficulty with self compassion or healthy engagement, you can find self compassion exercises, mindfulness based stress reduction courses are also available throughout life. Exercises and eat right too. During moderate exercise, about 5 times a week can dramatically help your mood. Moderate exercises is a level of activity where it is difficult to sing from your diaphragm doing it. Also, pay attention to how the type of food or drink you are eating influences your mood. You don't have to do fad diets, but anyone will be depressed if they frequently binge on carbs, junk food, and energy drinks. Remember the virtue of moderation. Another, relationships. Focus on people who lift you up. Interact frequently with others that bring you up. While it's okay to have some alone time, find a balance and don't isolate yourself or the depression will linger. Sleep regularly. Try to keep a regular sleep schedule. Keep a balance with not too little and not too much sleep. Staying up late one night and then sleeping in excessively the next day is a surefire way to feed depression. Also, don't try to solve problems late at night when your brain is half asleep. As you practice these coping skills, know that you are on the path to overcoming depression. In contrast, depression tends to linger when patients make up a reason why they can't do these things. No matter what medication you are taking, during several of these activities every day, especially when you don't feel like it, is vital to the treatment of the depression. These positive coping skills may take time and practice, but if we don't take the time to be well now, the permits of unwellness may be forced you in later. Having depression can be tough. It's easy to feel hopeless and wonder if you will feel this way forever. Sadly, it does not really work that you way, but that doesn't mean you will always to feel the way you do now. Treatment. versus cure. When someone is cured from an illness, it means it's gone forever. Some illness can't be cured like diabetes. Once a person gets diabetes, they will have it for the rest of life. But even a lifelong illness like diabetes can be treated. People who take their medications regularly and make some lifestyle changes can live long and healthy lives. These medications and lifestyle changes are treatments for diabetes. Depression is the same way. There is no cure of depression, but there are lots of effective treatments. People can recover from depression and live long and healthy lives. Several types of medications can be used to treat depression. Most of these are called antidepressants. They work by restoring the balance of the chemicals in your brain. How do antidepressants work? There are a few different types of antidepressants. They face or they work each by restoring the balance of the chemicals in your brain, but each medication works on different chemicals and affects their defortune. The brain chemicals we are talking about are called neurotransmitters. They send messages from one brain cell to the next. Different transmitters. They send messages from the one brain cell to the next. Different hero transmitters send different types of messages. The most important one for understanding antidepressants are particularly away from it. Number one, serotonin, which affects your mood, energy level, appetite, and sleep. Number two, which affects your energy level, focus, and attention. Related to adrenaline and has similar effects. Next, dopamine, which affects motivation and the pressure, sometimes called the feel of good chemical. Each antidepressant has slightly different effects on these neurotransmissions. This is why the same medication that works for the 12 months. How do I take and anticipate depression? Antidepressants are taken daily. They often take several weeks before they have a non-noticeable effect. You can't just take an antidepressant everyone once in a while. On days where you feel especially depressed, you are not be tempted to stop talking them as soon as you feel better, thinking that you have been cured. Unfortunately, antidepressants are not a cure for depression. They are a way of managing it, not a way of making to good aspect permanently. Some people are able to eventually stop talking them depressed, but there is no show in talking them for long periods of time or even for our whole life. If you do decide to stop taking an antidepressant, it's best to talk to the good while fixing these things, etc. You can often do this by everything. Your tablets half for a few weeks, then into the fourth for a few more weeks. They may also help you find an attitude that has fewer side effects or if more influence. Next, side effects. All mental health medications have the potential for side effects. Each medication is different for information about the side effects of a specific type of antidepressant. Read to the articles on SSRI, TCAs, and typical antidepressants. Depressants include number one, changes in your lifestyle, weight, or sex drive. Changes in your sleep, appetite, weight, and sex drive. Feeling nuisance of dirty headaches. In rare cases, antidepressant can virtually he make you feel more depressed or have suicidal thoughts. If this happens, talk to your doctor right away if you are having uncomfortable suicidal or a plan somewhat. It is considered most antidepressants have the potential to cause serotonin syndrome, which is rare but serious. Serotonin levels in your brain get too high. It usually happens whom you are taking more than one medication. Symptoms include feeling confused and agitated, and twitching muscles, sweating or shivering, darkable. In the most severe cases, it can include seizures, regulation, heartbeat, loss of consciousness. In addition to anticipate, there are other types of medications that can sometimes help with depression. Many of these are designed to treat other and conditions such as anxiety or bipolar disorder. Medication is also not the only treatment for depression. Therapy is helpful for many places. Life has its style changes, eating foods that help you feel energized and healthy, doing enjoyable activities and getting more exercise are good places to start. Sri Kantai Kalyana Nidram Sri Venkatavasaya Srinivasaya Mangalam Mangala Sarvadacharya Sarvesha Purvai Acharya Sarkutaya Sumangalam.